Depending on where you live, you could be paying more or less for health care. Joining me now is Teri Dreher, and she's with North Shore Patient Advocate. Great to have you back on the show, Teri.
Thanks so much. It's good to see you again, Angie.
So tell us about this study.
Well, this was a study done by the Dartmouth Institute for Health Policy, and it's one of the largest studies of its kind done in this country that really studied the demographics of healthcare utilization and costs in this country.
What did the study find? What did it reveal?
Well, there's a huge variation in healthcare utilization. It's highly localized, and this has several different reasons.
What are some of those reasons?
Well, one of the reasons is the physician themselves. Physicians practice a little bit differently in different parts of the country, depending upon the culture of the area, whether they're in the city or whether they're out in rural areas and underserved areas. And many people have found over and over again that having a primary care physician will actually lower hospitalizations, keep people safer, healthier, and happier at home. The demographics of where seniors live in this country are really interesting. Most people over 75, there's a higher concentration in the North, Midwest, and Eastern area of the country, and north of California. But the rates of the percentages of older people living in the Southwest and Alaska are very, very low. So that has a lot to do with healthcare dollars being spent.
Anything else about location?
Location, well, actually, it depends on how close people are to hospitals, too. The rural areas, it's harder to get to hospitals. It's not so easy. And in the cities, people tend to have many, many more visits per year. In New York City, for instance, people have up to 20 to 22 physician visits per year, as opposed to more rural areas where they may only have 2 or 3 visits per year.
So does that mean people who live in those cities are paying less than the people who live in rural areas, or is it the other way around?
Well, it's a very complex formula because every state in the post-Affordable Care Act world has different payment structures, and the price of health care will be different in one hospital as opposed to another hospital also. A lot of it has to do with how efficient, how accountable the hospital is, because Medicare does fine hospitals for too many 30-day readmissions, which they see as an indicator of poor discharge planning.
Well, what can people do, or what are some solutions here so there's more, maybe there's a more equitable way to come up with pricing?
Well, I think one thing we need to do in this country is educate. For instance, only 10% of Medicare recipients actually take advantage of their free yearly exam. And free yearly exams are very, very important in prevention. Only 50% of the people in this country actually have a primary care physician. So some commentators are saying that Medicare needs to change itself and build in more of the health and wellness incentives to keep people out of the hospital and stay healthier longer, because people really are living longer.
Thank you so much for your insights today, Teri.
Thank you very much, Angie. It's always a pleasure.